From its early beginning in December 2019, the novel coronavirus, SARS coronavirus 2, has been affecting the entire world.
Good morning, sir.
Good morning. In March 2020, the World Health Organization declared COVID-19 a pandemic or a disease affecting the entire globe. Countries all over are resorting to very drastic means to cope with the impacts of this very dangerous disease. In this video, I'm going to share with you information that will help you to keep safe at work and be better able to take care of your loved ones at home. The novel coronavirus, COVID-19, can cause illness ranging from mild to severe and in some cases can be fatal. Symptoms typically include fever, cough, and shortness of breath. Some people infected with the virus have reported experiencing other non-respiratory symptoms. Other people who may be asymptomatic have experienced no signs at all. Symptoms of COVID-19 may appear in as few as 2 days or as long as 14 days after exposure. The virus is thought to spread mainly from person-to-person contact, including between people who are in close contact with one another within 6 feet or so, and through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. It is also possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, possibly their eyes. But this is not thought to be the primary way the virus spreads. People are thought to be most contagious when they are symptomatic, that is, experiencing fever, cough, and/or shortness of breath. Some spread might be possible before people show symptoms. There have been reports of this type of asymptomatic transmission with this new coronavirus, but this is also not thought to be the main way the virus spreads. Everyone is at risk of getting COVID-19, but those at highest risk are persons who are 60 years and older and persons with underlying medical conditions, which include heart disease, diabetes, lung disease, asthma, and many more. You can help yourself and your loved ones stay healthy by washing your hands often, especially before, during, and after preparing food, before eating food, before and after caring for someone at home who is sick, before and after treating a cut or wound, after using the toilet, after changing diapers or cleaning up a child, after blowing your nose, coughing or sneezing, after touching animal feed or animal waste, after handling pet food or pet treats, and after touching garbage. Washing your hands is easy, and it's one of the most effective ways to prevent the spread of germs. Clean hands can stop germs from spreading from person to person and throughout an entire community, from your home and workplace to childcare facilities and hospitals.
Follow these 5 steps every time you go to wash your hands. 1. Wet your hands with clean running water, warm or cold. Turn off tap and apply soap. 2. Lather your hands by rubbing them together with the soap. Lather the back of your hands between your fingers and under your nails. 3. Scrub your hands for at least 20 seconds. Need a timer? Hum the happy birthday song from beginning to end twice. 4. Rinse your hands well under clean running water. 5. Dry your hands using a clean towel or air dry them.
Washing hands with soap and water is the best way to get rid of germs in most situations. If soap and water are not readily available, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. You can tell if the sanitizer contains at least 60% alcohol by looking at the product label.
To properly apply and use hand sanitizer, follow these steps. 1. Apply the gel product to the palm of one hand. Read the label to learn the correct amount. 2. Rub your hands together. 3. Rub the gel over all the surfaces of your hands and fingers until your hands are dry. This should take around 20 seconds.
Besides sanitizing your hands, disinfect surfaces that are touched frequently, so-called high-touch areas, such as doorknobs and handles, countertops, elevator buttons, and other such surfaces, even your smartphone or other mobile devices. The following are some disinfectant chemicals which can be powerful cleaning agents. Isopropyl alcohol 70% or rubbing alcohol, household bleach mixed in the right proportions, ethyl alcohol at concentrations of 60 to 80%, sodium hypochlorite at 5.25 to 6.1%, hydrogen peroxide, and iodine. Please do not mix chemicals when cleaning. This is very dangerous. Some procedures to remember when you have to wear a mask or a respirator.
When putting on a mask or respirator, be sure to secure the ties or elastic bands at the middle of the head and neck. Next, fit flexible bands to the nose bridge. Then fit snug to face and below chin. And finally, do a fit check. When removing a mask or respirator, remember that the front is contaminated. Do not touch. If your hands get contaminated during removal, immediately wash your hands or use an alcohol-based hand sanitizer. Grasp bottom ties or elastic, then the ones at the top, and remove without touching the front. Discard in a waste container. When putting on gloves, be sure to extend to cover your wrists. When removing gloves, remember that the outside of the gloves are contaminated. If your hands get contaminated during glove removal, immediately wash your hands or use an alcohol-based hand sanitizer. Using a gloved hand, grasp the palm area of the other gloved hand and peel off the first glove. Hold the removed glove in the gloved hand. Slide fingers of the ungloved hand under the remaining glove at the wrist and peel off the second glove over the first. Discard gloves in a waste container.
Wash hands or use an alcohol-based hand sanitizer immediately after removing all personal protective equipment. Use safe work practices to protect yourself and limit the spread of contamination. Keep hands away from the face, limit surfaces touched, change gloves when torn or heavily contaminated, perform hand hygiene. Physical distancing is not the same as self-quarantine or isolation. Two other practices being utilized to minimize the coronavirus spread. The key difference is that a quarantine or isolation restricts the movement of people within a certain area or zone to limit transferring and spreading an infection. Physical distancing places no such locational constraints. Rather, it is a behavioral practice to lower the risk in most circumstances. The objective of physical distancing is to reduce the probability of contact between persons carrying an infection and others who are not infected, so as to minimize disease transmission, morbidity, and ultimately mortality. It includes avoid contact with someone who is displaying symptoms of coronavirus, avoid non-essential use of public transport when possible, work from home where possible, avoid large and small gatherings in public spaces, avoid gatherings with friends and family. Keep in touch using remote technologies such as telephone, internet, and social media. Use telephone or online services to contact your GP or doctor or to get other essential services. The following measures to contain respiratory secretions are recommended for all individuals, especially those with signs and symptoms of a respiratory infection. Cover your mouth and nose with a tissue when coughing or sneezing. Use the nearest waste receptacle or bin to dispose of the tissue after use. Perform hand hygiene, for example, hand washing with soap and water or alcohol-based hand rub or antiseptic hand wash after having contact with respiratory secretions and/or contaminated objects or materials. Remember these 3 simple actions: catch it, dump it, kill it. Isolation and quarantine help protect the public by preventing exposure to people who have or may have a contagious disease. Isolation separates sick people with a contagious disease from people who are not sick. Quarantine separates and restricts the movement of people who are exposed to a contagious disease to see if they become sick. Be sure to follow bulletins by the Ministry of Health and Wellness and the university channels for updates and new measures. If you suspect that you have come in contact with or have contracted COVID-19, please call the Ministry of Health and Wellness hotline 876-1-LOVE or any of the numbers listed on the screen.
Do you think you need support or recognize someone who does? Do not hesitate to contact the University Counseling Services at 876-521-3473 or 876-551-0118. You may visit www.mona.ue.edu/COVID-19 for campus updates and general resources for COVID-19 virus. If you have questions or concerns, please send an email to covid19questions@uemona.edu.jm.
Defeating COVID-19 requires all of us to take the necessary steps to protect not only ourselves, but to be our brothers and sisters' keeper. Stay home, stop the spread, save lives.